Dave Asprey, the supposed father of biohacking, put out a brainless tweet. He showcases this person's peer-reviewed reanalysis, it's not even his own study, of the largest birth cohort comparing vaccinated and unvaccinated children and seeing their risk of various chronic diseases. He is referencing this study that looked at about 16.5K children that have at least received one vaccine compared to a little under 2,000 that had no exposure to vaccination. And the argument is that the more exposed to vaccines that you were, the higher chance you were of developing a chronic health condition. And when you're looking at the data head on, it looks kind of concerning. Especially when you consider down here, no vaccine exposure, those that had diabetes, 0. Those that had ADHD, 0. Those that had behavioral disability, 0. It leads you to believe that vaccines are the cause of the bad things that I was mentioning before. However, there are many limitations. One of the big ones is that they only relied upon medical records to determine diagnoses, meaning that if it wasn't documented in the patient's chart, they're not counting it, which is ironic that they call this a strength. Which leads you to believe, well then, wait, what if they never went to the doctor? That's a great question. Exposed children, meaning those that have had at least one vaccine, had an average of 7 encounters with a physician, as opposed to unexposed children only went to the doctors on average twice a year. That is a big difference. If you're not going to a doctor, there is less of a chance of a doctor diagnosing the kid. You could see how that could skew the results. 2. The sample size, and just using common sense. Remember, the no vaccine exposure was about 2,000 and the vaccine exposure was above 16,000. That's a huge mismatch. Let's go to the most popularized one in the conspiracy theory media, autism. In 16,000 patients, they found 23 cases, and in 2,000 cases, they found 1. If you do that math, they're about equivalent. Even the incidence per million patient years, it's 1.1 compared to 0.9. The p-value is nowhere under 0.05. They are equivalent. That tweet from earlier, they said there was a 180% increase in autism. They're not even trying to do the math. They're trying to scare you. These grifters use their large platform to scare people to then purchase their product because they want you to believe that they have your best interests at heart. They don't. Don't get scammed. Take back your health.